Hi students, Instructor Grant here. I am going to go through a few things with this unit. I'm not going to go through each section of this lecture notes. That is your responsibility, but I am going to point out a few things. Okay, so as we know, type 1 diabetes, category E10, is also known as juvenile type. This is where the disease in which the pancreas produces little to no insulin. The patient needs regular insulin to sustain life, where type 2, category E11, is which the pancreas produces insufficient quantity of insulin or the body does not utilize it adequately. So one thing that I do want to mention, you also have secondary, which is E08 or E09. Make sure you review those categories. These are due to an underlying condition. So E08 could be due to congenital rubella, Cushing's syndrome, cystic fibrosis, again, as you read through, where E09 due to drug or chemical induced diabetes. Example would be steroid induced DM. Then we have others specified, so E113. This includes diabetes due to genetic defects, beta cell function, and insulin action. Okay, so the other big thing here that I want to talk about for this section is the Z79.4 long-term use of insulin code. So one thing you need to do is make sure you verify the documentation. Look at the medication, determine whether that patient takes insulin or oral hypoglycemic drug. Patient who takes oral hypoglycemic medication has type 2. Remember, go up to here, type 2 is going to be E11. Okay, so they have type 2. When patient has type 2, secondary DM or other specified DM, and takes insulin, at that point the coder should assign Z79.4, unless the record specifies that the insulin is being given only for a short period of time just to control that blood sugar. At that point, then I would not use it. It's up to the facility's coding. Okay, the other thing that I want to point out here is if the medical record documentation is not clear with regard to the type of diabetes, the default category is E11, type 2. When the type of diabetes is not documented, but that record does indicate the patient uses insulin, the default is still type 2. Basically, that documentation has to state type 1 for you to code it type 1, or of course type 2 to code it type 2. The fact that a patient is receiving insulin does not indicate that the diabetes is type 1. So this is really an important statement to remember. Okay, so for the organization, make sure you read through the lecture material. We have a great little chart here. So once again, make sure you keep going back, read through all this other information, because I'm going to talk neoplasm, and then I kind of want to go through a few things on the practice case. So gestational diabetes, one thing to make a note here, it's not a true diabetes. It usually goes away after the pregnancy subsides, and pre-existing diabetes in a woman is not the same as gestational. Okay, so if you have category 024, this is used for both pre-existing and gestational. However, 024.4 cannot be used with any other subcategory of 024 code. Also, the Z code for long-term insulin use is not to be used with 024.4 subcategory. Okay, so the next thing real quickly is our abnormal glucose test. You will see that they are R codes. Okay, at this point, just because you have an abnormal glucose does not mean you have diabetes. Okay, so let's move on to our neoplasm section. Okay, so the biggest thing here, you always want to locate the morphology. So you want to look up if it's carcinoma of the lung, sarcoma. So you want to look up each type, okay? And once you look up that type, the morphology, it's going to tell you to go to the neoplasm table, and it's going to say see neoplasm by site benign, see neoplasm by site malignant, or in situ. It's going to direct you where to go. Okay. So the next thing I want to go here is primary and metastatic sites. You will notice that the column under malignant is further subdivided into primary and secondary. A primary site indicates, keep this in mind, indicates the origin of the tumor, where it started. A metastatic site secondary indicates where it went to or the tumor has spread. So make sure you really pay attention to this. And the biggest thing is here is you are looking to metastatic too. So if they say liver cancer metastatic to the lung, that means it started in the liver, spread to the lung. No. Keywords here, to and from. Okay. Sometimes you have multiple sites. When there is metastatic site mention, all the metastatic sites must be coded as secondary. So again, you can have more than one secondary site. So sometimes you'll have a single metastatic site, but they may say that word metastasis. If that word metastasis comes into the picture, then you're going to need an additional code to state, hey, there was another site, but we don't know the primary site, or we know that it metastasized, but we don't know the secondary site. So keep in mind your C80.1 and C79.9. Okay, so metastatic of, the coder is not able to determine if the known site is primary or secondary. In this case, the site is assumed to be primary unless found on the list below. So once again, make sure you really go through this PowerPoint, not PowerPoint, but the notes. Okay, contiguous sites, those are going to be, your fourth digit's going to be 8, not C20, not C21. Make sure you review your official guidelines. And then we have Z codes. These are patients treated in the outpatient, admitted or treated in the outpatient setting using radiation and chemotherapy. To find that Z code for radiation therapy, you can go to admission 4 and counter 4. Keep in mind, one thing with these Z codes, if a patient is admitted solely for chemotherapy, that Z code needs to be principal diagnosis. Personal history of Z codes. These are assigned when that primary malignancy has been excised, eradicated. If the patient continues to undergo treatment for that primary malignancy, then the appropriate primary neoplasm code should be assigned. So when you research, the index refers to history. Be careful how you choose those codes, because you have to make sure, is it personal history, family history? So make sure you really know. And like I said, always look at those subterms. Know where you're at in that coding book. Okay, so then we get into lymphomas. They're systemic diseases. Those are going to be the C8-1s through C8-8. They do not metastasize as a situation with solid tumors. So keep that in mind. We have leukemia, which is our blood-forming tissues. So here we're just talking about our different types of cancers. So make sure you read through all of these. And then we have our complications, which remember are going to be our T codes. Okay, so we are going to go through case 1. Okay, so make sure you read through the discharge summary. let's go down here. Which of the following is the correct ICD-10 CM code assignment? Okay, so with this, sorry about that, we want to make sure that our G89.3, which is for pain, document is being related to the cancer. It can be assigned as principal diagnosis when the admission is for pain control. And that is what's going on here. So we want to make sure that it's our principal diagnosis. And then we're going to have our C79.8. That is the malignant secondary column. We also have the Z8 5.3. This is history, personal malignant neoplasm for the breast. We also have dehydration, which we're going to code, and we're going to have diabetes. And the very last one will be for the failure congestive. Z90.12 could be assigned to indicate that the left breast has been removed, so you would just go to absence breast. As you can see, it wasn't put in here, but I am fine with the absence codes. All right, so case 2. Let's keep in mind, we're going to start off here with the Z code. All right, patient was admitted for chemotherapy. It's always principal diagnosis. Then we're going to go the T code. We have a complication going on. And then we code the table of neoplasm, transplanted organ. And C22 is hepatocarcinoma. On to case 3. So hopefully, keep in mind, if anybody has any questions over this lecture, over any of these answers, please contact me. All right, so here we have case number 3, and let me get here. With this one, we're just doing the POAs. As you can see here, C79.51 is going to be secondary. We have our D24.2 as our principal diagnosis. So let's look at what it's telling us. For information for ICD-10, the patient is still under treatment for both the bone and lung metastasis. So at this point, they're active. The patient has a history of right breast carcinoma, an acquired absence of the right breast due to a previous mastectomy. So when a primary malignancy has been excised or eradicated from its site, there's no further treatment directed to that site. There's no more evidence of an existing cancer there. That's when we go to the Z85 code. So keep that in mind. And at that point, you can also add in the absence code. Okay, so then we go into our left mastectomy code, root operations, resection, and then we have the tissue expanders. So if anybody has a question over that, let me know. We have all are exempt, yes, present on admission. And when you put these into the encoder, a lot of the, especially for the Z codes, it'll pop up saying Y or exempt. Okay, case 4. Once again, we're basically looking here. We have our cancer codes, we have our exempt codes. No PCS is assigned. The patient did have physical therapy, but that is not deemed a significant procedure per the UHDDS guidelines. So keep that in mind. All right, so if anybody has any questions over these case studies, please reach out. So hopefully this helped you and help right along with the neoplasm. I always, to me, dissect the neoplasm. It's not a hard chapter to code. Just take one section at a time when doing it. Once again, any other questions, let me know.